I am really excited about this presentation. We're going to be focusing on risk management, the leadership role you didn't know you wanted, and also that you're probably doing and don't realize it. So I want to introduce our wonderful speaker for tonight, Dr. Josh Hyatt, and I'll read a quick bio and then we'll get into, we'll just have a conversation. And please do, as you come up with questions and such, drop them into the questions box. We'll have plenty of time to address those as well. So I will read Dr. Hyatt's bio. So Dr. Hyatt is a distinguished fellow of ASHRM Ashram and has a healthcare career specializing in healthcare administration, risk management, patient safety, leadership, and ethics. He holds a master's of bioethics from Harvard Medical School and both a doctor of health science and a master of health law from Nova Southeastern University. Currently, Dr. Hyatt is the Director of Consulting in Healthcare at Presidium, focusing on professional sexual misconduct in healthcare settings, and is an adjunct professor at several universities where he teaches courses in ethics and patient safety. I was included here at PayPath. He has held leadership roles in Coveries, MedIQ, Jackson Memorial Hospital, Keck Medicine of USC, and other institutions. He's contributed extensively to healthcare ethics and risk management through publications, presentations, and his professional service. A certified professional in healthcare risk management and patient safety, and a certified professional in patient safety, Dr. Hyatt is actively involved with the American Society of Healthcare Risk Management, where he is on the advisory board, editor of the ASHRM Journal, and faculty lead for the CPHRM prep course. His impactful work has earned him multiple awards for leadership and excellence in the field. And I am just so delighted to have you here. And so Josh, I know that you needed to go off camera for a bit. Josh is actually traveling,
Yeah.
and so he is, so he may be on and off camera a bit, just so that you all know that. So I wanted to start, Josh, with kind of a level setting question that I sometimes hear. What is risk management exactly, especially in the context of healthcare?
Thank you. And I apologize. The internet at this hotel is not very good, so I went off camera to save bandwidth.
No worries.
Your question about what is risk management is a really interesting question. So generally, risk management is the process in which you protect your organization, you protect your resources in your organization. So if you look at risk management in finance, that's what they do, right? They look at investments and they figure out how to mitigate loss, meaning how do you keep money from going away? And healthcare risk management started about the 1980s. And what they found was in healthcare, there was a couple of things happening. People were getting hurt a lot, and they couldn't get malpractice insurance. So the practice of risk management actually was born out of the 1970s malpractice crisis, where physicians and hospitals couldn't get insurance. And so the insurance companies were saying, look, you guys have these huge losses. You're doing all these things that are really harming patients. And so we're not going to insure you. And if you don't have malpractice insurance, either as an individual provider or an organization, I mean, that's a huge gate in your portfolio. So one lawsuit could knock you out completely. It can completely wipe you out, depending on how those are set up. So the field of healthcare risk management was born out of the insurance crisis of the 70s, and it really started to kind of grow in the 80s. And so what risk managers at that time were doing was they were looking at records, they were looking at auditing, they were looking at documentation, and they were looking at basic practices that would kind of reduce the risk of malpractice. So they to put in programs that would keep the hospitals from getting sued or healthcare providers from getting sued. And it's kind of started from there, and it started growing. And then it kind of started to branch out into different things. And so by the 90s, which is kind of when I entered risk management. I've been in risk management for over 30 years, which is kind of hard for my brain to wrap around and believe. But in the 90s, it kind of started evolving into patient safety and really looking at operational practices in hospitals. What are we doing in hospitals that keep patients safe? The theory being, if you keep patients safe and they don't get hurt, then you're going to reduce your risk to the organization from a financial perspective, right? But then it started growing and they started saying, wait a minute, there are other things. There's reputation. There is protecting our providers, our nurses, our doctors, our therapists. All of these things started playing a much bigger role. And so risk management grew from there into an actual field. And ironically, in the 1990s, the state of Florida required people that wanted to be called healthcare risk managers to get licensed. It was the only state that had that provision. It fell under the Department of Insurance. I lived in the state of Florida at the time, and I decided to do that and got a license to practice risk management. And what it really was a mechanism by which hospitals could report events to the state, and the state could work with those organizations, and they called them Code 15s. I think they still could use that term. And it was if you had what was called a sentinel event. So this was sentinel events before like Joint Commission started calling them sentinel events. And so if you had one of these events that were like catastrophic, there was you cut off the wrong leg, and that was actually the really big case in Florida that started really that whole thing, was Tampa General Hospital cut off the wrong leg. And it started the whole practice of universal protocols and site marking and all that. And so Florida risk managers were kind of in on the first element of how that worked. And so it's really now evolved into an extremely robust and thoughtful profession. So we've moved from kind of risk managers to we are now risk professionals. We are the people that really work to protect our patients, to protect our organizations, to protect our providers in a myriad of different ways. We also look at risk management has grown into different fields. So there are 5 principal fields in the role of risk management. There's the clinical risk management, which is what we mostly think of. Those are the people that work in the hospitals, right? They do the incident reports, they do investigations when bad things happen, that sort of stuff. Those are the patient safety clinical risk managers. But there's also financial risk managers, and these are individuals who specialize in insurance and how you get insurance for your organization and the types of insurances you get and all that sort of stuff. And that's a very specialized area. There's claims and litigation. So those are risk managers that really focus on how to manage lawsuits. So from the time the lawsuit's filed to the time that it's resolved, they work that entire case. And they often work very closely with attorneys, and they're generally employed by insurance companies because they're the ones that are managing claims. But those kind of risk managers really walk through the entire claims process. And then you have operational risk managers that kind of work in large institutions, and they kind of try to organize and structure the programs that are in place. And then you have the legal regulatory risk managers, who are the ones that understand the healthcare laws, that are involved with regulation, survey certification, accreditation, all that stuff. So it's actually a huge branched out kind of profession. That was a long answer.
That was, wow, yeah. So that makes me wonder what actually is the difference, there because it is now a broad profession. So what is the difference between, sort of quality, safety, and risk in the health professions? Or is there one now? Has it become really blurred?
It's a great question. So it really depends on where you work. And I always say, if you've seen one risk manager, you have seen one risk manager. because risk managers have always been I always called them the dumping ground. When anybody doesn't want to deal with something, they would give it to risk management to go deal with. And risk managers became very talented in juggling different things and trying to figure out, well, what does this mean in the context of that, right? So there, you know, there are some organizations where risk and quality are combined. They are kind of the same profession, right? So the risk manager does both kind of roles. There are some organizations where risk and compliance are combined. And they're often, that's actually kind of a new model that's starting to emerge, where they would take risk and quality and break them apart and make it risk and compliance, because they put that kind of often in the more like legal bucket. These risk managers are really focused more in the regulation, the legal piece of it. And then quality combines with patient safety, and they look at more of the application in the operations. So if like there's a sentinel event, something bad happens, it's often in those models, quality and patient safety take the lead on the investigation. Risk comes in to say, what can we do? What are the things that we need to do to mitigate loss to the organization and protect our patients and providers, right? And then quality and patient safety would do more of the work. In other organizations, you have risk managers who do everything. They do risk, quality, compliance, patient safety. So it's kind of a mismatch. When I was doing my dissertation for my bioethics degree, my dissertation was on the interconnection of ethics and risk management in health law. And kind of why I put like this kind of diagram together. So you had legal regulatory as like one piece of a Venn diagram. And the legal regulatory piece is this is what you have to do. The law says you have to do this. This is what you have to do. Then there's the patient safety bubble, right? And patient safety is about, this is based on evidence-based research. These are the best practices in clinical medicine. So that's where we start talking about clinical protocols and those sorts of things, right? So that's more the clinical science-based information. And then the third bubble was ethics. And ethics is the right thing to do. So what is it that you should be doing that is benefiting patients, that's benefiting the organization and humanity as a whole? And so when the three of those converge, I kind of said like in the middle where those three intersected, that is risk management. Risk management is pulling from all three of these areas in order to actually do the work of what a risk manager needs to do.
Wow, that makes a lot of sense, and I hadn't really thought of it that way. So thank you for that. Now, and as I've talked to you, outside of this broadcast and then here, I can definitely feel your passion for and hear your passion for this field. What drew you into risk management as a career?
Yeah, I always get that question. It's kind of a funny. I started my career, actually, I started off in mental health. And I worked in inpatient adolescent psych. I was working towards becoming a PhD psychologist. That was kind of what I wanted to do. And I did that for about 5 or 6 years. And I started very young. I started at 17 years old working inpatient psych. And I realized at a certain point that I didn't really want to do that. I realized I didn't really care about the science of medicine. What I was really fascinated in was the art of medicine, how things are done, why you do things, how you make things better. So I kind of moved into an administrative position. I became an associate administrator of a psychiatric hospital. And oh, I'm sorry, hope you're still hearing me.
I am.
Are you there?
Yep.
Okay. So the internet was down. Oh, it was weird. Anyway, so I kind of started out doing that in an administrative function, and then I saw an opportunity to go learn about this thing called risk management in the early 90s. And I had no idea what it was, but it looked fascinating. It was a 6-month course that you went every Saturday all day, and then I could sit for my licensing in Florida to become a risk manager. And that's kind of how I fell into it. And I loved it because I was learning things I had never knew anything about: risk management, administration, quality, compliance, regulation. So none of these things I really knew at all. And I found them to be extraordinarily fascinating. And I kind of started in that area, and so I kind of moved into that. And so my career trajectory has held me in regulatory positions. I've worked for the federal government, I've worked for state governments, I've worked in academic medical centers, I've worked in long-term care, I've worked in behavioral health, insurance. I kind of have spread the gambit because I wanted to learn as much as I could about the different approaches. And so it's kind of been kind of a great, and then along the way I found ethics, and I'm like, well, ethics interconnects with all of this, and I really love this. So that's kind of how I pulled it all together.
Wow, that's impressive. Um, yeah, so now I guess turning back, um, looking at the current healthcare environment, what are some of the biggest risks that healthcare organizations are facing today?
Um, well, that's a great question because every year there is ECRI, which is ECRI. They do a top 10 patient safety risk management list. Like, what are the top 10 issues that year? It's a great thing to research and keep an eye on. I get it every year. I live by it. I think it's fascinating. So, like, the topics that you will often find, like nowadays, for example, AI is a huge one. We both ethics and risk management don't really understand how AI is going to change the face of medicine, and how it's going to continue to change the face of medicine. And that is a huge risk. There's a lot of liability, there's a lot of potential for harm, there's a lot of ethical questions that come up with how those different kinds of approaches are used. So that is a massive one. And I saw AI started back in the 2010 was the first time I actually ever saw it used in healthcare, and it was used by a radiology group. And what they had was an AI program that they, with their mammography, what they would do is they had an image, and so the radiologist would read the image, and then they had an AI that would go behind the radiologist and start identifying things as potential, like, did you look at this? Did you look at this? Did you look at this? And it was interesting because it helps improve healthcare, but it can also make healthcare longer because many of those things that were flagged out were really not findings, or they potentially could have been, but the radiologist is kind of overwhelmed and can't always figure out exactly what that particular shadow means, right? So it put the radiologist and the radiology group at risk for potential liability for lawsuits if they miss something. But at the same time, it improved patient care. So it was just kind of this, it's that kind of thing. There's a lot of questions about it. AI is a big one. I currently work my work right now is really focused on preventing sexual abuse of patients in healthcare settings. It is a really difficult topic. It makes people very uncomfortable. I work specifically with companies, and the modeling that we use is a risk management model. And when we do risk assessments, what are the things that you are doing that prevent either staff or providers from abusing patients or patients abusing patients? And so we do a lot of work like in behavioral health and long-term care, and in sensitive areas where you have sensitive examinations. And one of the main reasons is I was unfortunately a executive C-suite risk manager for a healthcare organization that got hit with one of these claims. And it was a provider who sexually assaulted young girls in a student health department for over 30 years. And it changed me as a person. going through that process, and because you don't want to believe that there are predators in healthcare, you don't want to believe that that exists, right? People go into healthcare to help people, but there are predators. And then there are people who are not predators, but they do stupid things. They commit boundary violations and stuff like that, and they put themselves at high risk. And when we start looking at the numbers now in healthcare, the average cost to settle a sexual abuse claim is $59 million. Just think about that. One claim can cost you $59 million. We have had claims. My claim at my organization was $2.2 billion. And because it was a very prestigious university, it had a lot of endowment and could cover that. Most places, of course, it would shut their doors instantly, right?
Yeah,
So,
exactly.
so there are risk management. So this is how I apply risk management in this particular area. So we go in and we look at where are your high risk areas, what kind of training are you doing, what kind of monitoring and supervision do you have in place, the policies that you have in place, the investigation process, like how do you get information, how do you investigate it, how do you resolve these cases, when do you involve law enforcement, when do you involve the state boards, those sorts of things. And it can get very complicated. And I mean, I wouldn't tell you the horror stories that I hear on a daily basis of things, but you can go on Netflix. There's at least 5 Netflix specials you can watch on healthcare sexual misconduct that will raise the hair on the back of your neck. That kind of risk management, for example, is a very specific kind of risk management. Most risk managers are much broader, and they're looking at risks within large systems. Another big area of concern and risk right now is drug diversion, where we have individuals who are diverting drugs in clinical settings, which is not only causing harm to them as a person, but potentially harm to the patients. So if you are in an emergency room and you have a nurse who's diverting fentanyl or a narcotic, that means that they're generally injecting the narcotic into themselves and filling that with saline. And they're providing saline to patients who are in abject pain. So there's lots of harm that's tied into that, right? So there's ethical and risk management issues tied into that. So and then I think at a much larger context, probably the biggest risk that we see today is related to the policies, the healthcare policies that are being implemented by the current presidential directives. A lot of these policies are shutting down already. They're already shutting down rural health clinics, which decreases access of healthcare to people, especially in those highly vulnerable areas. And the other part of it is there's a lot of uncertainty tied into it. So they say they're going to remove money, or they're going to cancel research, or they're going to divert Medicare funds or Medicaid funds. And organizations do not do well when there's no consistency. So healthcare organizations have to plan 5 years in advance to be able to stay afloat and work. People think healthcare organizations just have trillions of dollars that come flooding in, and they all sit around in bathtubs bathing in the money, right?
No.
And it's not that way. Hospitals, healthcare systems are so expensive to maintain, and having uncertainty in the market. So this is kind of where risk management, healthcare, and risk management financial start intersecting. When there's uncertainty in the markets and in policies, and you don't know what's expected or what's going to happen, how do you plan? And it creates a lot of volatility, not only in the application of healthcare, but in like being able to grow. So an organization may want to start growing, right? They want to buy another hospital or another medical group. Well, they don't know if they even should at this point. So things start getting shut down, quality starts to decrease, harm starts to increase, and then we're going to start seeing a lot of lawsuits that come in based on negligence and malpractice because of a lot of this uncertainty in the markets.
Wow, that is a lot of risk, and huge areas of risk too. So how, and especially when you think about the uncertainty, of regulatory and policy and funding, so how do we manage these risks, in this environment? Or really in any environment, so in sort of like the world that a little bit of a calmer world, which
Mm-hmm.
is difficult to find in healthcare. And then, today and kind of the volatility.
So that's kind of where you have kind of two primary arms that look at this. You have the finance arm and you have the operations arm. And your finance arm is really looking at how you control risk. So simple example, you have a car and you have to have a license to drive a car, and you have to have insurance when you drive that car, right? That is state imposed risk management for an individual. You have to have those particular things. In some states, they're even particular about you have to have this much coverage, or you have to have this much, coverage for certain things. So what happens is in that particular case, the state says you are eligible and qualified to drive a motor vehicle, and they give you a license. If you don't have a license, you can't drive a car, no matter how old you are or how long you've been driving. And so in risk management, it's kind of the same thing. The government gives you certain leeways. Okay, you are an organization, we're going to give you this many beds for this purpose. You're going to get this much money for the care that's provided, and so forth. So they give you kind of the framework. The second part of it is then, now that you have it, now you have to figure out how are you going to pay for something if something goes wrong. And that is where the finance piece comes in. So when you get a car or car insurance, right, or health insurance, one is the first thing that you usually ask about. What's covered and what's my deductible? Those are the things you want to know, because that's money out of your pocket, and those are services that you need to have. And so risk managers have to sit back and look at an organization collectively and say, how much money, how much risk are we willing to have in our organization? And so we have to buy insurance, or sometimes they decide to self-insure. They go in with other organizations and they say, hey, let's all pool money together, and let's pool our money and let's self-insure each other because it's cheaper than going to the market. Or sometimes you'll go to the market and you'll get a malpractice insurance and a negligence insurance coverage. And then there's certain types of risks that you just say, I don't want to take. So for example, like if I'm in a medium-sized hospital, I may not want, for example, to deliver babies. Delivering babies is extremely high risk. When a bad baby case happens, it's catastrophic. It's very expensive, right? And so a lot of organizations are saying, you know what, I no longer want to offer obstetric services. And so the risk for them at that point becomes almost zero because they no longer offer the service, right? Unless they have an emergency room and then EMTALA kicks in and then they have to do it anyway. But they don't have to maintain the baby there, right? So organizations can determine, it's called risk avoidance. I don't want to do this anymore because it costs us too much money. The insurance is too expensive, or there's too much volatility, or there's too much risk in that particular thing. But I will finance my cardiac and neurosurgery departments, right? So there's risk avoidance, there's risk financing, which is the insurance piece of it, and then there's risk transfer. So I may say, for example, I don't want to hire emergency room physicians because the cost of their insurance is too high. It's risky, and we're not experts in emergency medicine. So I go out and I contract with a emergency room group, and they supply the doctors and they staff it, right? So that's the transfer. So there's different ways of how you manage risks. Those are the three principal ones.
Thank you. Um, so so we've been talking a lot about risk. What does risk management kind of look like in practice? So, what might a typical week look like for a risk management professional? The kind of the avoidant, the preventive piece, just kind of that planning, and then, the day-to-day kind of work that you do.
So yeah, this is great because it depends on what kind of risk manager you are and what
Mhm.
kind of organization you work at. So if you are like a traditional healthcare risk manager or clinical risk manager that works in a hospital, often you during your day, what you're doing is you're doing evaluations of events that have occurred, incident reports, which is what they use to really kind of dig in, and that's the risk manager's first inclination that something has happened that they need to address. There are investigations. There's a lot of consultation. Like when I worked in the hospital settings, all day my phone would be ringing, doctors would be calling me. Do I need an informed consent for this? Or the patient said they're going to sue me. What do I do? Or I'm in the OR and I just lacerated somebody's artery, which was an actual call of mine. And I would say, get off the phone and go fix the patient, and then let's talk about it afterwards. You know, or God forbid, a patient just stated that they were sexually assaulted by their nurse, putting on EKG leads, they groped their breast, right? Or whatever these events are. When you work inpatient, I always told every risk manager I ever hired, your day is never what you expect it to be. So whatever your calendar says, that's cute, but that's not what your day is going to look like. It's going to be the crisis of the day. Now, hopefully you can get to a place where you start doing preventative risk management. So what are those things that you can do that actually prevent certain types of events or incidents or types of harm? There's a lot of relationship building. Risk managers that sit in their office all day and just read incident reports and make a few phone calls, they're completely ineffective. They don't get anything accomplished. Risk managers have to be out on the floors, talking to people constantly, gauging the temperature of the room, and really understanding what's happening in the milieu, and then to build trust with your providers, and so that they come to you. And like I would have my providers come to me and say, hey, look, something just happened, I need to talk through it. That's what a good clinical risk manager in a hospital will do. It's busy. And then sometimes they may be doing quality stuff, so they may be pulling data and doing reports and analysis, or they could be doing compliance and investigating compliance things like from the hotline, or making sure that they're compliant with the OIG regulations, right? So there's lots of different pieces depending on what's really in their role. If you are a finance or a claims risk manager, your life is usually like in an insurance, and in the insurance, or working with brokers and working with clients. Like the claims person, they live through the whole incident, like a whole claim, from the time it gets filed all the way through to its resolution. So they're constantly engaged with attorneys, courts, reviewing medical records, developing expert witnesses, and doing all that sort of work to make sure that the claim kind of goes through its process. Legal regulatory people, we look at things like, what do the laws say? And where, because every state has its own crazy set of laws. So people say, well, can I do this in this state? And I'm like, I don't know. It depends on what the state laws are. I don't know all the state laws off the top of my head. There's about a trillion of them. So it really depends. I think the most traditional risk managers are those hospital-based risk managers. Those are the ones that people think of. So they're probably the biggest slice of pie. But that's changing. In fact, it's changing in our profession actually as we speak.
How is it changing? I'm just curious.
More risk managers are getting into other areas. They're
Okay.
either getting into compliance, or they're really, I've had a lot of clinical risk managers who were like, I don't want to do this anymore. I want to do consulting. or you do one-on-one work with clients like I do. Or they like, I want to do claims. I want to sit there and go through the whole claims process. I know lots of nurses who've gotten burned out at the clinical level and just said, I want to be able to sit down and not deal with all the crazy and just go, I want to do medical record reviews and talk to attorneys and manage claims. Or some nurses or some risk managers are attorneys and they actually are litigators and they go into court and do defense and stuff.
Wonderful. I ask that because a number of our students are, and this is really helpful. A number of our students would probably go the clinical route. They work in
Mhm.
hospitals, nursing, skilled nursing facilities, health systems. Then we have another pretty good slice of students who are very interested in going into, health insurance as well and
Yeah.
working for insurers. So that kind of segues really nicely into one of the questions I had on behalf of our audience is what are some career opportunities for people with an MHA, and the focus in risk management, that interest.
So yeah, it can be lots of things. So there's kind of a misnomer that people think you have to be a nurse to be a risk manager, a clinical risk manager. That's not true. I'm not a nurse. I was never a nurse. I went into risk management with my clinical background was really just in psych, but I was more focused in administration and that. There are a lot of nurses in clinical risk. There's a lot. There's also RNJDs, nurse attorneys who are in risk, but MHAs. I hire MHAs into risk, and so that's one area if they're interested in clinical. If you want to go into risk management, I always tell people at least start in the hospital setting, because if you don't start in the clinical setting, you don't understand how everything else and all those other pieces connect together. Um, but on the insurance side, for example, there are those that can learn. They go into there's the MHA can go into insurance arms where you're either doing underwriting, where underwriters who are writing policies for insurance companies, they work very closely with risk managers, because they need to understand because the risk manager is going to tell them, hey, look, if you write this company, you may lose a lot of money because their systems are terrible, right? Or they've got like really gaping holes here. And if you're going to write them, at least make them do something to fix the problems that they have. Then there's the claims people. So in insurance, you have underwriters, claims, and risk, or your three principal people. And the claims work very closely with risk because oftentimes the claims people are not clinical. They could be anybody. They could be MHAs. They could be clinical. They could be anything, right? And they're really working and those people that do that often love law. They love going through the legal process. They love watching stuff go through a legal track. And so they can kind of get into that, but they work closely with the risk manager because they'll often call risk and say, hey, in the lawsuit, this is what happened. Is there something that I need to know or understand from a risk management perspective about this claim? And you'd be like, yes, what happened was this, and this is where the failure points are, because risk managers that have a clinic, that have hospital experience will know, I know what you're asking. I know where that failure mode was because I've seen it about 1,000 times. So those are things. And then also in risk policies, writing policies, a lot of MHAs that I've worked with love doing kind of that policy piece where they interject, where policy connects with the risk management, and then how you go from writing those policies to then implementing them in a much larger setting. So I think there's a really broad application for that master's. And in healthcare, to be quite honest, in healthcare, mostly every job now, especially in any kind of management or kind of consulting type role, which is what I kind of consider risk, you need to have at least a master's degree. I mean, it's hard to even get an interview nowadays without a master's or a doctorate.
Okay. That's really great information. So, thinking about that, so they need their masters. Are there other, sorts of skills or credentials that would be valuable for someone who's looking to get into career management, say to get into that hospital?
Um, yeah, it really depends on the hospital. I would say I've had this question a lot from people that want to get into risk that have not worked in a hospital before. You can't just jump in and be a risk manager.
Mhm.
So you kind of have to start at the bottom because you have to learn what that process, because it's complicated. In the ASHRM, which is the American Society for Healthcare Risk Management, which is our national organization, I'm faculty lead for our national certification prep exam, which is called the CPHRM. It's a certified healthcare risk management professional. And if you, in order to really, in order to really understand what you need to do, you just have to kind of do it. Um, and so I would say start with your internships. Think about what are the areas that I'm really interested in. I really like clinical risk. I really like claims. I really like compliance. I really like quality and data where I can sit down and cut and slice data all day. Everybody's kind of got their own passion about what they do. And I would say in your internships, find where that connecting point is so that you can at least get a taste of it in an internship, and start there, and learn as much as you can, because then you'll either fit like me. When I started in psych, I had this whole plan laid out, and then like 2 years in, I'm like, yeah, no, this isn't going to work for me. um, but I found my passion a little later on by happenstance. So that's kind of where I would recommend kind of starting and looking, and then explore and talk to people. If you want to know what it's like to be a risk manager, talk to a risk manager. If you want to know what it's like to be a compliance officer, talk to a compliance officer. Your professor should be able to help connect you with the right people to have kind of those kind of conversations.
Absolutely, yes. We would be really happy to do that. Um, so so as people are starting out, one of the things that kept kind of coming into my mind is, risk awareness wherever somebody is in their field. And not everybody, on the webinar or viewing the webinar later may go into risk management as a career, but we can all be risk aware. And just kind of vigilant for what's happening around us. Are there strategies or habits that people can work towards to help them develop that risk awareness mindset in their work?
Is that is a superb question, and risk managers fight with that all day long, because oftentimes we are thinking when we see an event or something has happened, we go, why on earth would somebody think that's a good idea to do? And where's the critical thinking that went into this decision? And so being risk aware is, it's a perennial question. I think the first thing I always tell people when I've done like risk training for non-risk managers is you have a oftentimes when something's not right. And the first
Mhm.
part of that is training your gut to accept that. You're going to go.
Yes.
My mother was a professor of nursing, and she did most of the clinicals, right? And she used to tell her students, don't do what the nurses are doing. Do what I tell you to do. Because what happens is in a clinical setting, they're going to kind of do what they want to do. They're not always going to follow the policies. They sometimes do things that are unsafe. Um, and so you want to teach people the right way to think about things. In risk management, there's almost no right way to think about something because it's all contingency based. It's like a good, like it's like an attorney. They will always say, what is blah blah blah, and the answer is it depends. There's so
Yeah.
many circumstances in which things can happen that you may not even fully understand. What I always say though is if the hair on the back of your neck stands up and you know that something's not right, talk to the risk manager, talk to your immediate supervisor, figure out what's going on, because 99.9% of the time you are right if it doesn't seem like something's right. And that to me is the most important risk awareness tool that you can have, is your own gut. The other part of it is to really build relationships within different departments so that you can talk to people and say, this doesn't seem exactly right. From your perspective, what do you think? And start hearing different points of view and different perspectives, because we get so siloed in the way we think. So like if you're an ICU nurse, you get siloed thinking like an ICU nurse. And if you go from ICU to med surge, your thinking is completely off. And it's kind of the same way with risk or quality or any of those things. If you get siloed, you think about things in one very particular way, and you don't realize that there's a whole different world out there that looks at that one way of doing things differently. And they may be better, they may be worse, there may be ways to grow, there may be ways to infuse that together. So as a consultant, I will often tell healthcare leaders I'll say, don't think of silos, think of lanes. Everybody's got a lane, and you just need to know where everybody is on their lanes. But if you're in a silo, you're not paying attention to what other people are doing because you can't see it. And so working together and really having a mentor or something like that really is powerful when you're first starting off. And if you can find somebody to be a mentor, that is also a great sounding board, so that when you go, this doesn't seem right, you have a good sounding board to really bounce it off of. I've been in risk management for over 30 years. I've been in healthcare for more than 35 years. I have people that I reach out to this day and say, you know what, I had this really weird case, and this is just I just need another thought. I need another brain to help me understand it and put it in context. And that, if you don't have that, then you're isolated and you kind of live on an island, and it's terrible.
Yeah, definitely. Th- you have just offered so much guidance this evening, and I'm almost like, should I ask this? But I am going to ask this one last question. Um, if before we turn to our audience questions, what is one piece of advice that you would offer someone just beginning in their career or their academic journey? Around preparing themselves.
Yeah. I guess my first bit of advice is to be curious. And I know it sounds trite, but it's real. It's if you look at your job as a series of tasks, I have to do this, and then I have to do this, and then I have to do this, and then I have to do this, then you're never going to really understand what you're doing. Ask the why. Okay, I got to do this, but why? How does this fit into the bigger picture? How does this benefit the patient? How does this benefit our system? Just be inquisitive and ask why. And then ask why to the point where people want to kill you. Because the more you ask why and the more frustrated people get, it's often because they haven't asked why enough and they haven't thought about it. And then eventually, if they have enough experience, they'll have thought about it and go, oh, now it starts to make sense in their own minds. So that's what I would say. You have to do that. It doesn't matter if it's academic or if it's professional. Just ask why. Why am I doing this? What is the point? And then you will learn from that how these things interconnect.
That's powerful. Often, times people, they may have known the why, but they get so wrapped up in the work and the stress and, the constant change and they forget or they push it off to the side because they're so busy just doing and trying to catch up and stay caught up and serve everybody. And, you know, having to just take that step back and remember the why too is it can make a big difference in the organization and the team.
Yeah,
So
I
love
agree.
that. Yeah. Thank you so much, Dr. Hyatt. This was incredible. I'd like to open things up. We have about 8 minutes or so. I'd like to open things up for our audience. If there are any questions. And Samantha, I think you've been monitoring the questions box.
Yes, I have. It does not look like, as of yet, that there are any questions. Just a couple of comments thanking you both for the presentation tonight. But we can certainly see if any questions trickle through in the next couple of minutes. And
We'll
if
try
not,
the camera now. See if
perfect.
this works. Okay. There we
There
go.
he
I am here.
is.
And if
I
any
apologize
questions
for being
come
off camera.
up, I will be sharing this recording with you all tomorrow via email. So if you think of any questions after this presentation, you can feel free to send them to me and I can forward them over to Dr. Zendel and Dr. Hyatt.
Sounds great. All right then. Well, shall we
Thank
wait
you
another
so
minute or close
Uh,
up?
yeah, I think it's okay that we close up. Like I
Okay.
said, I'll make sure I follow up with everyone and can see if there's any other questions that pop up. But thank you both so much for joining us and having this hot topic here tonight.
My
Yes, and
pleasure.
thank you to
Thank
all of our attendees. Oh, sorry, Josh.
Oh, no, no. No, I just thank you, everybody. I appreciate it. I hope this was helpful.
Definitely. Thank you. Good night, everybody. And thanks.